Hi, everybody. Welcome to another episode of ASAP Pathway. I'm your host today, Dr. Stacy Ochoa, and I'm super stoked. Really excited to have our guest today, Dr. Steffen Decker. I want to do an introduction of him, and then we're going to dive in. Dr. Decker is a specialist orthodontist in lingual orthodontics. He's COIS trained recognized specialist. He's a program director in dentofacial orthodontics and in clear aligner orthodontics. He enjoys teaching and lecturing all over the world in the field of orthodontics. And in 2017, he was awarded world #1 lingual incognito provider. Since 2021, he's belonged to the top 1% Invisalign kids and teens providers in Europe, the Middle East, and North Africa, and was awarded the prestigious Diamond Apex status. In 2022, he became the first and only COIS recognized specialist in the UK. That's pretty amazing. He is the director of 2 programs at the City of London Dental School and Bolton University. Dr. Steffen is also an official Invisalign clinical speaker lecturing worldwide. And without further ado, welcome, Dr. Decker, Steffen. I'm so excited to have you. I just wanted to say,
don't say so many. I get emotional because I don't want to hear these things all about me.
oh, you're amazing. And I
I'm
was
just,
stalking
I'm
you
just an
on videos.
orthodontist who's super passionate about whatever he's touching. And why we are connected is because we share the common passion of changing the lives of our children. And I've read your story with your dad.
Oh, now you're going to make me
So,
emotional, Steffen.
yeah, I don't want to get into it because I understand that. But when it comes to children, to our own princes and princesses, it's so different. And since I ventured into that thing with prevention, it's just eye-opening. It becomes really emotional. It becomes very close to your heart, the topic. And what I try to do, like I always try to do, since I did obviously, when I treated adults predominantly, I was focused on cosmetic orthodontic with lingual braces. That's where I became very famous for. But when I changed 5 years ago, predominantly to children, I just changed the approach to something cosmetically, which is really good for children, which is an aligner, clear aligners, predominantly at that time Invisalign. And I realized, compared to what I used to do in Switzerland with prevention, these Schwartz expanders, also what I see on your side with the screws, but more bulky devices,
Right.
I realized that using actually clear liners for the same thing has so many advantages. And the main thing is kids love it.
That's what people
And
don't understand, Steffen, is when I tell people, I literally put a kiddo, a 4-year-old in aligners this week. And when I tell people that, they're like, well, that must have been a horrible appointment. They're great. They love it.
they are better than any adult I ever treated.
Exactly.
So I say always to my patients, I'd rather see 10 children than 1 adult.
Yeah.
And the problem is, especially in UK, it seems to the main focus of all dentistry is adults. Get these adults treated with aligners, and everyone seems to forget these young little vulnerable children who might get bullied at school, who might not sleep at night, who might get infections every so often, who might get diagnosed with ADHD, who might get all sorts of problems, and we are just ignoring it. There's nothing we can do for you.
It's so interesting so you and I just hopped on literally 5 minutes ago. And I was just, we're doing like, hey, nice to see you. And we immediately,
we didn't even do that.
we're not. And we immediately, when you experience this in your life and you find another person, another soul that is as passionate as about this as you are, it's this immediate connection, appreciation, validation. And I'm just so appreciative that you are across the pond doing this in an environment, Steffen, that isn't really open to this. So what would you say to orthodontist, general dentist, pediatric dentist that they say, well, nobody in my town is doing this? What would you say? Because that's your environment.
Look, it's not even my town. In the whole country, there is nobody who does what I do. I do rapid maxillary expander, 3D printed aligners. I combine the two of them. So, but what I would say is we're getting pushed into a category because as an orthodontist, nowadays we compete with every dentist in the UK.
Yeah.
Because it seems to be the market is only adults and teenagers, and everyone is doing the same because nowadays dentists are the new orthodontists. They go on a weekend course and they suddenly become orthodontists because the company is telling them you can move teeth. You're great. So AI technology is the same. You press button and suddenly you get a magician cartoon showing the tooth movement and everything is good. But where do I differentiate myself again in my life where I'm different? And the difference is the diagnostic and to link what we see in a mouth with actually what might have happened the last few years before they even came to you. Because being a Coy's graduate, let's start with John Coyce, who opened my eyes in terms of the restorative sighting, the destruction on teeth in adulthood. And where is it coming from? How is it linked? And at the end of my course, I asked John, could that have been prevented having had good orthodontic care early? And he couldn't give me an answer. He said, probably. So then I said, let's look at that. And because I see whole families with the same malocclusion, I can pinpoint it down to 4-year-old. You see initial times of wear. It gets 7, 9, 14, 40, 50. You see the destruction over decades happening.
Yes.
And then now I go even back to birth. Let's start about breathing. We have a constricted upper arch. Yeah, we have dry lips. So we know straight away they're mouth breathers. So then when they're mouth, we need to ask ourselves, why is this child mouth breathing? Where is this tongue sitting? The tongue is low. Why is the tongue low? Maybe it's tied to the floor of the mouth. So then you see that and you ask the mom, how was breastfeeding for you? She said, disaster.
Horrible.
Couldn't breastfeed my child. Then I said, what about ear infections, tonsil infections, concentration, pressure control when you fly in an airplane? Wow, disaster. How's concentration at school? Disaster. We are pre-diagnosed with ADHD. So how do you know all this? I said, I look at your teeth.
It tells a story, Steffen, and
it tells the story.
It tells the story of the wellness of the child. And there is, it's interesting that we're seeing, in the United States anyway, I'll speak for what we're going through here, which you're probably experiencing as well. I've seen some things that have been happening in the UK regarding orthodontists trying to step out of a paradigm and people wanting to push you back into your hole, like get back into your hole, because people don't want to change. They don't want to shift their mindset. They don't want to shift the model of their practice. Some people are very uncomfortable with that. So they're kicking and screaming with this wellness approach, comprehensive. And the issue is your diagnosis, my diagnosis, because we're looking at the child as a whole and we're asking the questions, why are they like this? Not just how can I mechanically fix this, but why are they like this? And all of the health ramifications that have happened beforehand. And why, if we're seeing the car accident of prior health problems, breathing, sleeping, all these other issues, could be tongue tie, poor muscle tone, that caused this snapshot of a train wreck that we're seeing right now. It's like, why not intervene? Why not get that kiddo? They're behind in their growth and development. There was a hiccup in the growth and development, and it is our obligation to get them back on track.
Look, it's also when I teach, I always say to my students, your job in a consultation is, because I'm completely private, everything is privately funded, not NHS paid for. So I need to create so much value in my consultation for the parent to make the decision, I'm willing to invest money in the health of my child. So You can do that with the classic approach like every dentist does and orthodontist. Oh, here's crowding. Let's move the teeth there and there. I say the problem is in the UK, early prevention is not being done. It's not being heard of. We wait for all teeth to erupt and then we do something. So if I talk about malocclusions only, the parents will go to their dentist and will say, oh, this is what he said. He said, no, we don't do this in the UK early. Boom, they don't do it. But if I link this problem with actually health problem they experience for years,
Yes.
the parents understand, hold on a minute, he didn't talk about teeth. He talked about the health of my child. And my child is not sleeping. My child gets infections consistently. My child had tonsils removed. Then it just adds so much value additionally to the eventually tooth. Because sometimes I have wonderful teeth, class 1, but in baby teeth, no gaps.
There you go. That's a malocclusion. That's the first sign of a malocclusion.
Right. But on the medical terminology, dentists say, no, it's nothing we should do. But then we say, how is the sleep? And you link this. They say, I want this. I just had a patient in. Referred, that is super interesting story. I treated a 5-year-old girl with sleep apnea, CPAP machine. 5. The dentist, the parents were both dentists in the UK, had no idea about early intervention. They heard about me. They came for a consultation. They got all information. They said, yeah, that makes sense. I treated this girl 6 weeks with a rapid maxillary expander and a face mask at night, corrected the class 3. She sleeps better, behaves better, eats better, breathes better, everything. So now today, the first referral came from the dentist of a child, 7 years old. They had all teeth extracted because of decay. Class 3, no teeth because they were all extracted, not sleeping, mouth breathing. And I just explained just now, that's why I was a bit late. I said, you have no choice now, because if you don't do anything now, you will be an adult with 6 permanent teeth being extracted, double jaw surgery, and you suffer the whole way through to your adulthood time. And if you're unlucky, you don't have the financial means to pay all this to fix it.
It is so... Okay. You said so much. My brain is reeling because what the naysayers of early interceptive orthodontics. So in the US, even there were groups of orthodontists. I did an interview with Dr. Mike DeLuke a few podcasts back where he goes through the naysayers, the papers from the orthodontists in academia who say, nope, no need for early interceptive orthodontics. But we are seeing so much in our practices that warrants further investigation and more research. And that is happening. But what people are wanting right now, Steffen, is where's the research? Where's the literature? But we are the ones paving the path for that. You have to start somewhere. And to me, it's supervised neglect. I've seen too many children be helped, and to sit and wait for literature to completely validate what I'm seeing as a doctor in my own office. So what are you seeing in your practice that makes you so passionate to do it?
I mean, when you look at research, how is research being done? It is done in universities.
Yes.
So, first of all, we need to get universities on board who do this modern type of treatment I do. None of them do. So I tell you another story recently. I had a 7-year-old boy with an old-fashioned arm-E and a face mask. And unfortunately, the arm-E had imprints with acrylic, so it blocked with the lower jaw, so it was interacting, so it was not sliding forward. So as a consequence, because it was gastritis, they had recession on the lower teeth. So they came for me for a second opinion. So I said, who's doing this? I'm amazed. Who does early intervention? I'm so happy. So they told me. it's an NHS consultant in London hospital. I said, huh? What? I thought the NHS is not providing that sort of treatment. I need to reach out to this consultant. I want to do joint forces. Let's get this done. I reached out, says, can I please ask, how do you do that early? I thought there's no fund for that. And he answered me nicely. He said, actually, the NHS doesn't prohibit early intervention. We are free to do whatever we want in children, but just nobody does it.
Mm.
So I said to him, I want to give him advice what I would change in the approach to make that right, to get the malocclusion sorted. And guess what he did?
Oh,
He
no.
removed the device with this kit and said to the parents, we have to stop now. It's not working. We will wait and later on do jaw surgery.
What?
7, 8 years old.
Why
So
did he
now the
stop
parents
after
are
your
not,
conversation? What did it freak him out? I mean, what was his
yes,
deal?
he got scared. So this is what I'm dealing with. That the NHS system is so thing that he might have had good idea, early good approach, which I shared my passion for. I wanted to help him and reach out to him, and zack, out. We as classic NHS, we wait and later on do jaw surgery. So now they're coming to me.
And so what are these kids, what are his symptoms? What's your approach gonna be
Same
with it?
as your experience as well. Not sleeping properly, fiddly, not concentrating, infections consistently, ear infections. They can't fly an airplane because of pressure control.
Because of the pressure in the ears.
Look, if you do that every day with all of your kids you're getting, you repetitive because you see it in every child.
It is
Constricted
it's
arches.
literally like a pandemic. It is everywhere. It is, I mean, and it's interesting. There was a orthodontist that posted an opinion article in the AAO or the AJODO journal, and he's so against this really early interception and the discussion of all these health issues. And it was just interesting. You can hear, I don't know if it's fear. I don't know if it's anger and fear. I don't know what it is, but he said, if you want to have all of these discussions and talk about sleep and breathing, you should have went to medical school. And I'm thinking, you are an oral physician. We are just saying be more comprehensive. There's a child attached to that malocclusion, and there's a reason for the malocclusion. And all we're asking is start asking why and start addressing the malocclusion. And guess what? When you do dentistry, when you stay in your lane and you do the dentistry you should be doing earlier, you have side effects of health improvements. We're not saying we're curing anything. We're not saying it's very multifaceted, but there's an airway above the arches. There's an airway behind the arches. And if you think that what you're doing in the mouth does not affect that, that is just beyond logic.
But what I think needs to happen also for your colleague is, what I realize is, dentists, like we talked about change. What does change mean? First of all, people don't even know this exists. So they are competently incompetent. They don't know that they don't know.
Right.
Then we come there, show them, actually, look, this is happening. They then become consciously incompetent because we're telling them you have no idea, which is like, oh, hold on a minute. I need to defend myself. She's telling me I'm not right. So that is scary. But what I would say to these colleagues is, imagine your daughter, and I have another case to that, gets bullied at school because of protrusion. She comes home, daddy, they're so nasty to me, crying every day because she gets nasty things said at school. If kids are being called slot machines,
right,
or whatever. So me as a father, my princess is coming home crying to me. I would first say, what can we do about this? If there's a need and the kid is crying out for help, and they come to one of us and we just close this gap so that this kid is not being bullied anymore, being called a slot machine. What did we do wrong? Nothing.
Nothing.
What did we do right? We improved their confidence. So, and no dentist, it doesn't matter how against they are about this thing we're talking about, they cannot deny we did something good. And that's it. What did we do wrong? We did something good. And everything I do, it depends. Why do they come to me? Is it a gap? Is it protruding teeth? Is it sleep? Is it concentration? Whatever their reason is, why people refer them to me, because we are growing only with word of mouth. People are talking. So if they come with any need, my job is to listen to that specific need and not to close the door and says there's nothing we can do. Because if we help that need, we did nothing wrong. Independent if we should do or shouldn't do early intervention, because on the malocclusion, it doesn't matter about the malocclusion. It's about the problem.
The problem that and this is something we mentioned too, when I've talked to other orthodontists, there's literature in the US from over 100 years ago where orthodontists were saying, when you see a discrepancy that may appear small, such as no gaps in baby teeth. This was a paper in 1918 saying you need to stop and ask why, because that is a malocclusion and it will not get better on its own. And you need to ask the questions. And then it's interesting because I think it's apples and oranges. When you have why you might proceed with treatment and your diagnosis versus the average, more traditional orthodontist or pediatric dentist or dentist, their diagnosis might be very different. And so their treatment plan is different. Their timing is different because we're coming from two different diagnoses. We're more etiology based. It's like, what's happening? And if you have a child with a malocclusion with no room for their tongue because it's been low in the floor of the mouth, yes, get them to the ENT. Maybe they need myofunctional therapy. Maybe they need an allergist. But now we have to create and get them back on track to where they should be for their age. That's all we're doing. And there are beautiful side effects of health
also,
ramifications.
Like you're aware with Dr. Sagi, what he's doing in the US,
yes,
in the
yes.
classification of the Ferris 6. So I always explain how is sleep connected. So I tell them the 6 points of Sagi explained in his assessment. A lot of these points we as dentists can actually address. We can address the narrow arches. We can address grinding. We can release a tongue tie if we are confident in doing so. We can change to nasal breathing with myofunctional therapy. So we can straight away go from a moderate to severe case to mild by just treating our area. Forget about the allergy test and all the ENT stuff. But we alone can definitely improve these things.
Yes.
And I did the podcast with Butego about the Butego breathing technique with Patrick McNewan.
Yes.
He goes all about nasal breathing, how impact it has on health and the diseases. So then we just talk about teeth and maybe tonsils, but we need to talk about oral microbiome and gut health. And, this is going far. But what I say to my patients when I know they are overwhelmed in my consultation, where I said, I will stop now because below this line is not really for me to talk. Because I can continue with posture, with gut health, and so on and so on. But then people think completely you're nuts because they come for teeth.
And then you're talking about a microbiome.
This wealth of information. And it says, I need to look at myself. I need to start taping myself. I need to do that. And they do. And then they go talking and says, wow, they become raving fans of your philosophy. And this way to talk to these colleagues, you were mentioned before, if you create raving fans of your mythology, of your messages, they believe in you so much that they just talk and it grows your business from a completely different revenue stream because when you see children, you see their siblings, and they always come with a parent. So end of the day, you go on the marketing side for the children, but you get the whole family.
Yes, you do.
So
Yes, you do.
everyone is focusing about aligners and adults, and we make you smile and lower the price and dump the price down. In kids, when you created so much value and help them, there's no value to this. It's unvaluable, the things you do. And where also I just start now with doing courses. You do courses already. You started all this educational thing because
Yes.
you understand as me, you can't do it alone. You
Nope.
can't create the change by yourself. Our dedication, our mission, it should be to get the message out there to our colleagues, share our passion to make overall a bigger difference to our children.
And you know what? Exactly that. And we do, and this is why in ASAP Pathway, we have courses on early intervention taught by orthodontists that have airway and wellness in mind, skeletal expansion, different things like that. We want to do it the right way. We want to have, appropriate, stay within your lane, do it the correct way, not these weekend courses that overpromise and underdeliver. It's about doing it the right way. When can we intervene? The age group that's best. What are you accomplishing at 4, 5, 6? What are you accomplishing at 7, 8, 9? What are we accomplishing in puberty? And I mean, it's so important to teach this the right way, because I feel like when we launched ASAP, Steffen, it was like, look, we have one shot to do this right. And there was so much thought because there's so many naysayers, and we want to do it in a way that we are educating dentists, orthodontists, pediatric dentists, that it is research-based. We are not purely anecdotal, but trust us, we are all discussing in our groups what we are seeing every day, but we are also incorporating recent literature, what works, what doesn't work, because there's such a company, as you said earlier. You can go to these weekend courses. Here, throw a little device in a kid's mouth and everything's fixed. That's not how it works. And to your point earlier that orthodontists are feeling the pressure from all the general dentists doing Invisalign on adults. This is my point to the orthos is you have such an impact as orthodontists. You guys are geniuses with growth and development. You had so much training in growth and development of the craniofacial structures. The impact an orthodontist can make in a child's life is mind-blowing. You're so beyond Invisalign adult. So if you would expand your mindset and start seeing children, I mean, you should have a line out your doors that goes on for days and days and days as orthodontists because of the impact you can make in these children's lives. And do you know who Sean Carlson is in the United States? He's an orthodontist as well. He has a really interesting orthoscience, CBCT based treatment planning. It's amazing. It's a database for orthodontists. I just have so much respect for him. Early on, he was lecturing to orthodontists, and I'm a general practitioner. I'm a general dentist, and he allowed me in his class. But he gave the speech you just basically gave to a room full of orthodontists. Like, look, you're feeling this pressure because now general dentists are doing aligner therapy and taking your kind of everyday bread and butter adult orthodontics. If you don't start opening your minds to the potential of wellness and the impact you can make in these younger ages, I mean, forget it. Your job preservation is opening your mind to what you can be doing with these kids. And
So
general
I tell you
dentists,
my personal story.
yeah, we don't want to take away from the orthodontist. I would love to see these littles and set you guys up for success.
When I came 9 years ago to London, I was in Switzerland and did early interceptive orthodontic because that was my training with Schwartz expander, bionator, activator. So I came into central London, into the main medical area, and I was seeing only adults because you had these flying in patients back left, very famous people. So I decided the only thing I can do there is lingual because it's cosmetic and it works. So, but then Invisalign became stronger and stronger, and I've seen the uptake of treatments not as big anymore because my price packet was very high and they're all undercutting me with aligners. So I started with another clinic who did all align bleach bond. They align the teeth, they bleach them, and they cover them with bonding. That's it, really common in the UK. So the only consultation that I were left with was surgery cases because the dentist said, "Oh, I can't treat that. That's for Steffen to do." But then I came home and I remember really well, I was crying at the table and says, why did I study for so many years just to see surgery cases of people who can't even afford it because they all came through social media? So I had to change. I said that I can't be doing this. So then I was approached by a kids company and I changed from 100% adults with lingo to kids doing with aligners. I had no idea if it works or not. That was over 5 years ago. And I realized it works really well. And suddenly, from being depressed, what I see every day, my heart opened again. And I became happier because I had made this change on these children. And the thing is, we as a fundamental training orthodontist, we are trained to treat people with growth and development. But for some reason, we forgot this because we got pressured by companies to compete about adult market. We forgot what our fundamental training is, which is growth and development. So now we have even technology, we have AI, we have visualization, we have aligners, we have so amazing technology, remote care to cater for this Gen Alpha, Gen Z generation in a way we could never do it before. And I stepped into that. I thought, wow, this is so much potential and it fulfills you with love and happiness. And no dentist is actually interested.
And that is so true. That is so true too. And that's the thing. Like once kids get into the mixed dentition, this is me personally. I have tons. I know other ASAP pathway providers. They love mixed dentition, skeletal expansion. Me personally, and it's interesting because when I talk to other general dentists, because we're busy with, I'm placing implants. I am crown, bridge, dentures, partials, veneers, implants. I mean, I'm so busy. But I will not and cannot ignore a child that maybe local orthodontists would not be helping 3, 4, 5, 6, 7 years old. So then guess who had to do it? I had to do it because I can't watch it.
I hear that in Germany it's the same. Dentists, they speak to their orthodontists. They used to refer for decades their kids to. Says, please use modern technologies like aligners and 3D printing technology to treat these children. And orthodontists, unfortunately, they think they are God and they don't listen. So then they say, I do it the way I want it to be done. And then the dentist says, okay, if you don't want to do that, I will. Then they do the kids. Even sometimes they don't even have the qualification, education behind them. So they go on course after course after course to get the knowledge. Versus orthodontists, they sit at home in their practice, think they are God, forgetting that the world is keep turning and things are changing. And then they lose touch to this world, what's happening. And if I would be next to you, I'm pretty confident you would say, Steffen, you're much better orthodontist than me. Have them.
Have it.
And I get the restorative work. But orthodontists need to understand there's a huge market for you, but you need to be open to communicate with your dentist. You need to understand your dentist, what their needs are. You need to have eventually COIS background to understand dentists. Because
you really do. You have to have, there is a collaboration that has to happen for all of us to help more humans. And the more we're collaborating and talking and not throwing arrows into each other's backs, sitting around a table, get a cup of coffee. You know, it's so easy for people behind a computer to attack in an opinion paper or on these blogs, and they attack. And it's like, what are you doing? Do you really think that dentists and orthodontists that are seeing this in their practices and helping children, do you really think it's because we're money hungry? Because let me tell you, for me to stop and do a crown prep over here, and I make more money over here. Trust me, I make way more money, for me to stop and help a child. And it's not about the finances. Trust us, we have to profit or we can't help them. Okay. It's a business. We have to profit, but it's not about that. It's about, we're watching this life completely be wrecked by this child's prior issues that got them into this malocclusion in the first place. And we're intercepting. And then while we're intercepting, we're seeing the trajectory of their life change. Parents thanking us. It's like, you can't not do it. You can't unsee it anymore. And I have said, and now I am very fortunate. I mean, I've been beating this drum, Steffen, in my town for 15 years. I've been doing this for 20 something years with adults, and then started with kids about a decade ago because of my own children. And what's interesting is I feel like the orthodontists in our community, as they are having children, they're starting to be a little bit more open. So I don't know if it's interesting. I feel like that's kind of the metamorphosis, and we're starting to see some more literature come out to say there is something to this. So I'm seeing minds opening. The change is slow, but it's happening. I'm so excited. But I, as a general dentist, I still see these 3, 4, 5s because most of the orthodontists don't want to see children until 7, 8. And even then they're kind of, well, let's watch you every 6 months and then we'll do something later. But I would love nothing more than to, I help the little ones with maybe Invisalign. And I tell the parents, this is not saying they will not need orthodontics. The orthodontics might be easier down the road. We might be preventing some potential surgical cases down the road. We're also improving the right now for your child. The right now, better sleep, improve neurocognitive health right now when it's important, before age 6. After age 6, we know that neurocognitive deficits are kind of locked in. So I'm helping you in this demographic that nobody's really wanting to help. And I am not saying, I mean, my goal is to get you to an orthodontist, maybe when you're 9, 10 and need another expander or something like that.
They will never go there because they trust you.
And that is the thing. They ask, why don't you do it? And I'm like, I want I want to be able to refer.
Of course.
So I want to talk about, you told me before we went live that now you have a practice that's completely dedicated to children. So tell me about that. What's going on? What made you do this?
Basically, in that time period where I was really depressed, I said, my wife owned a general practice. She's a COIS graduate as well. She did full mouth rehab cases, everything. She just sold a business. And I came home not being happy. And I said, I really want my own thing. I said, no, I can't do another clinic. Oh, please. Anyway, she's seen my passion. She's seen what I did to the business I was working for with the children's side. And then she called back and said, let's do it. That was in the middle of the pandemic. We decided to get a loan, buy a building, and said, let's do a clinic focus on children. And how did I start? I treated my own children.
Yes.
And I treated my own children early. They were 6 and 7 at the time, putting some aligners in. And suddenly people kept knocking on my door. Excuse me, your children have braces. Why? So then we did a parent evening online on Zoom because we couldn't meet with 6 people. I said, this is why I do it. Oh, wow, that makes sense. Then these 6 people became patients. Then these 6 people recommended more. So out of the hiring a room at the beginning on an hourly basis in our village in a dental practice, within 6 months, we outgrown the room.
Oh, wow.
And then we sent to the bank, look, this is what we generated in 6 to 8 months, this is the income. Will you give us money? This is our business strategy. We got the money, we bought the business, we founded it, and when lockdown stopped, we opened it. And yes, we are growing slowly, 20%, but we're growing only with word of mouth. And the more word of people we treat, the quicker we grow, because they're all coming for the same thing. They're concerned about their child. And they're fed up of hearing there's nothing we can do for you. And because moms, it starts at birth when they can't breastfeed a child. They're looking for answers, and moms have a feeling their child is not all right. I can't get what I want for my child. But for some reason, they're hitting a wall in different areas. And then I come along, or you come along, says, this is connected to this. This is connected to this. They said, but hold a minute. I was looking for these answers for years. You just gave me in your consultation all the answers. What do I need to do? And like you said, when you do give them these answers, they will never, ever leave your side. And then if the parents ask you, actually, do you do dentistry as well? I have to say no, but my wife does.
Yes.
So we as a business developed a dental business on the side with no website, nothing, because we have the parents as well. And my wife already is 20 years in the area. And we know functional tools, we know coils. But also I want to come to one point, like I work in London for one clinic who's training dentists in align bleach bond, especially on the bonding side. And this person employs very young dentists, just freshly from graduation, whom they believe align bleach bond is the new dentistry. Forget root canal, forget full mouth rehab, forget functional occlusion. We just have to do alignment, then do some whitening, and then we cover everything with bonding.
Oh my
So now
goodness.
they're with me for a year. And sometimes I say to him, come in my consultation to listen. And now after a year, they say to me, Steffen, would you mind if you do all of my alignment cases? Because I have no clue what you do. This is far over my head. I don't have the knowledge. I don't feel confident anymore. I don't want to burn myself. Just can you do the alignment and I do the bonding or the veneers? I said, you understood the game now. I'm the orthodontist. I align you the teeth. I have no interest in your bonding or veneers or crowns. So it requires so much education from us to get to these colleagues. That's what we're trying to do with the courses, that you understand our courses are sometimes for people who might want to do it, but it's also for sometimes for people who want to know what are my limitations.
And that is it. It is not just how do I do this? It is understanding the more you know about this, you know what your limitations are, the cases you should touch, the cases you shouldn't touch, when to touch them. I mean, it is all about knowing what you shouldn't do is just as important as knowing what you should do.
And what you do as I doing now, you offer after the course these people a hand.
Yes.
And says, I'm taking your hands because it's no good me just giving you a course and taking your money for the course. No, I actually want you to do it. I'm mentoring you now.
Yes.
Show me your cases. Let's discuss it. Let's get you confident in that new area of expertise until you can go on your own. And that is such a lovely thing to do, that you help the hand. And that is what is so important, that it's not just giving the course and the education. It's also saying to him, if you want to, I'm holding your hand, come with the case, I discuss it with you, with my team, because obviously you can't do it all by yourself. And again, John Coyce is a big inspiration for me. He created this tribe, he calls, of like-minded people who are all successful dentists, but all of them come to his courses free of charge to help him getting this message across. And you are 2 years ahead of me, 10 years ahead of me with this journey. I have still 10 years of fighting in front of me, which you already had. If we at the end of our lifetime can say we started this venture of creating a tribe of like-minded people, me personally, I can say I'm doing okay. I've done a good job. And if we help some kids on the way, that is something good. And when I did dentistry only on adults, I felt like even I'm a good orthodontist and for me, achieved a good result. Sometimes it was not good enough for that adult because they had other problems. And
Yes.
that is something I can't cope with because I always give my very best. And that very best is sometimes just not good enough because of other reasons they might have in their life. And that is really frustrating and depressive versus a child. They come very innocently, very shy, very intimidated to you with a problem. You help them, they warm up to you, they smile at you eventually, and at the end they say to you, "Can I give you a hug?"
And oh my goodness, I was just going to say the hug, it's just such an authentic appreciation when you're helping this demographic, Steffen, is it not? It is such a beautiful, and then you see this, like, it's a legacy because you're helping this child grow into the next generation to carry the torch. And they love you. Like, they
love you.
Love you. It's not just like, "Oh, thanks, doc. This looks really good. I appreciate it." They love you. It's so authentic and it's so beautiful.
This is what I want in my family. This is what I want in my friends. And this is what I want with my patients. I can't, like when you go into London, it's a different pace, different people. It's very fast, everything, and very superficial. This is not me.
Mm-hmm.
I want deep. I want connection. I want these emotions because this is why I studied it in the first place. And when I did these adult dentists, it got lost because you get pushed into this corner, you compete with everyone. And when you speak to all these dentists who did Invisalign for a long, long time, at one point they feel exactly the same. They're fed up with doing adults because they can't fulfill demands. And now we are, as trainers, I feel like especially a lot of female want to do this for children because they have the connection to, they have their own children with needs. So I think even dentists and the colleagues need to be open to what we're doing. You from a dentist side, I'm an orthodontist. We are here to help. We are not here to take anything away from them. We want to make a change, but we can't do it ourselves. So we want to share what we got. And if they're too ignorant to accept it, okay, that's their fault. I mean, but I feel it will work. It takes maybe time, but here we go. But definitely look, for the last hour, we never met.
No.
We never spoke. We could meet tomorrow for dinner and we have the same fun time.
Absolutely. It's the truth.
Isn't that nice?
It is, because this is where, and I guess it's going to get kind of deep here, but this is where I believe we are here for such a time as this. I don't believe in coincidences. I believe we are here spreading the word for in the time that we were put here as practitioners, as healers, for a very specific reason, and we're fulfilling our purposes right now. It's very spiritual for me I feel like I'm connecting with people on a different level. I'm not just doing mechanics. It is life-changing. It's life-giving. It is, and the colleagues and the new friends I meet along the way who feel the same way, because you connect, because first of all, you're in the trenches together and we have the same mission. And I believe there is a bigger purpose greater than us, that we're supposed to be helping these kids. And maybe, Steffen, 5 years from now, we're going to look back at this conversation and this is going to be hopefully slightly more normalized, hopefully a lot more normalized, where if you could wave a wand and say, "This is how I want to see the future of orthodontics," what would it look like?
I think that the politicians understand there's a massive need for prevention in all sorts of areas. There needs to be funding for prevention because prevention overall saves the health system a lot of money. But end of the day, we're doing something right. And politics is also, they all have children. And I'm just waiting for this one politician to come with their child to me where he says, "Oh, wow, I need to address this." And that's what we need to go to television. We need to create this awareness. But what I would like is that even people who don't have the means to afford this, have the means to afford this. And that's what we are doing. We are now creating a charity
Wow.
where with certain categories, kids who come to us with a need and they just say to us, it doesn't matter how we reduce the price, they still can't afford it. To say to them, you know what, company, a liner company, will you give me the case for free? Or my time I give for free. So to get a charity going, if it's not funded by the politicians, by the health system, I think this is something I would like. And the bigger our community gets, the bigger we can join together and make that happen. And we need to create noise. It will take time. And that's why I reach out to you as well as you are on the other side of the pond. But eventually we have the same mission. We need to connect. We need to exchange. We need to talk with each other, help each other out in getting this message further. I can help you. You can help me. So I want the message to be spread, and I want people to understand there are so much more people who are not so fortunate, like in the area where I live, where people generally have the money to afford this, that they can come at least for advice and to get the help they deserve. We're not talking about cosmetics, we're not talking about malocclusion, we talk about health.
It's a humanitarian project, is what you're describing. And it's a beautiful idea. I think how amazing if the world could come together to help these children, and we're all over, and we can help people in our communities, the people that can't afford it as well, because kids deserve to sleep and breathe and grow and not have neurocognitive deficits and function and grow into their best selves. I love your idea of this global humanitarian project. I love it.
So look, we don't know where we be, but I think we will stay connected forever. So let's see where this journey takes us together. But like you and me, I'm so passionate about this, and I will never look back and say, I've done the wrong thing. So I will continue this fight, this journey, no matter what. But just to finish it off, how this all started was my wife telling me, have you seen your cases 30 years later? Then me going to this dentist in Seattle, John Coyce, who is this inspiration, this humble man who writes personal notes to thank you. And him inviting you as a keynote speaker, talk about this, and then he telling you, I love you. I love what you do. Keep on going. If that comes from such a well-educated man, then as an orthodontist being in a country where there's not been done, that you have this backup from someone who doesn't need anything from you, who just gives you his advice and his love and says, keep on going. This is for me what I need. And now talking to you, saying there's some more people who share the same passion. You're not by yourself. And when you need help, you can count on each other to support each other. I think this is what you talked about, the connection. And I think this is what we have to achieve. And I think we did it today for over an hour now. It went like this.
It did. And we could talk for hours. And we'll probably need to have another one. There's plenty to say between the two of us. I'm going to put in the link how people can reach you and get a hold of you. Nice. What is your website? How can people find you?
So basically, we are the orthodontic specialist.co.uk. they are also in the course section. We are our courses like you guys. So contact us on the courses at the orthodonticspecialist.co.uk. We try to do things maybe slightly different to you in terms of aligners. But I think the most valuable thing is we need to connect to maybe align. I know Leah Lipkin is with you. I know
Yes.
him really well because he does lingual braces as well. So you have a good guy in your team already. So I think it's about trying to exchange how can we grow together, how can we get the message together. So people in Europe are closer to me in your side. There's so much to be done. So I really appreciate this talk. It was actually quite emotional. Um,
I feel
but
the same. I
it's
feel the
nice
same,
to share
Steffen.
this passion. And I hope our audience shares the same passion and gets curious about what can be done. And thanks a lot for
I
everything.
just, you are a beacon of light over there. I,
Don't
I,
cry.
I can see your light across the pond, and you've been, it sounds like you have a personal mission to spread that light and to make some big changes in the UK. And I believe you're going to do it, Steffen. And
Thanks.
the reason I believe you're going to do it is because of your heart and your authenticity, and more importantly, your vulnerability. You aren't about being right, you're about doing right. And that's a big difference. That's a big
It
difference.
is.
Before we go, I always end on a journey back to your childhood. And I know originally you're from Germany. So I'm not up on all the German culture. I will say my maiden name is Becker. I don't know if you knew that.
Ah,
So I have a
I'm
lot of,
Decker, so
you're a
that's
Decker,
good.
I'm Becker. Maybe that's another connection we have. But I'd love to ask you three questions before we go is, what was your favorite game when you were a kid to play?
Favorite game. Well, I come from the countryside, so I come from the Swiss mountains. So everything to do with the ball. I was never at home as a child. I was always outside playing with the ball.
That's awesome.
Tennis, ping pong, badminton, football. I was outdoor
Always playing outside.
every
Just
day.
come home for dinner, Stefan. Is that what it was like?
Yes. The rule was by my mother, you're home at 6:30. That's it.
Oh, I love it. We need to get back to that. We don't have enough of that these days. And what great
So
memories too.
I have really good memories because there was nothing there. It was just us playing. It's amazing.
And creating. Okay, what was your favorite treat when you were a kid? It could be your favorite like dessert or meal, something you really loved having when it was special when you were a kid.
Strawberry cake.
Ooh.
Because where I'm from, we have only seasonal food. So I come from the Lake Constance, which is surrounded by fruit plantations. And we know which, basically, my mom used to bake every Friday night. So when we came
Mm.
home from sport, the house was smelling of cake.
Oh.
And I knew by the time what was on the cake, which fruit, I know which time it is of the year. So in June, May, June time, it is strawberry season at the lake. So we get fresh strawberries from the field next door. We pick it ourselves. And then we have strawberry cake. And then later on was apple cake, plum cake, raspberry cake, whatever season it is.
Oh.
So because I was never used to having mango or avocado because it didn't exist in supermarkets. So I come from an area where only farm shops, whatever they had on the field, they gave to us. So I love cake, but only German cake with a lot of fruit on it.
It sounds delicious.
Yes.
And when you were a little boy, what did you want to be when you grew up?
Wow, that's a good story. Basically, I was always in a village. I did a lot of neighborhood help. I did tutoring. I cared for elderly. I painted their fences. I did their bottles. So I earned pocket money here and there. So I always cared for people and I was tutoring. And when I came towards the A levels, obviously the question was, what do you want to do? And I was always good at school. So I said, well, I don't know. So my neighbor is a children's psychiatrist. She knew me since I was 6.
Hmm.
So she said to me very, very quickly in a German way, said, Steffen, you need to be either a doctor, to help people, or you need to be a teacher because of your knowledge. So now I'm both.
There you go. I was going to say, sounds like you're pretty much, you nailed it.
I combine the two things, which was always meant to be mine, which is caring for people and sharing it and teaching them. I love everything about what I do.
I can tell. And I think everybody listening can feel that coming through the speakers loud and clear. You're an amazing, amazing doctor.
I studied medicine first. And then when I was in the theater room and do these operations on these adults, and then the people said, let's have lunch and have biscuits, I couldn't do it.
You're like, sorry, pass on the biscuits after surgery.
So I knew the hospital environment wasn't for me, and I had 5 years of orthodontics. So I said, I think I need to swap to dentistry. And then I first of all realized I'm actually quite good with my hands. And then orthodontically, I need to tell you that story. So I was good at university as well. So in orthodontic, we had 3 exams, and we had to get 200 points out of 3 exams to pass the course. So after each exam is 100 points. So after 2 exams, I had 200 points. And so basically I didn't need to attend the 3rd exam. So I thought, because the day before the 3rd exam, there was the exam party of my friend who was a year above me. So I went clubbing, and I clubbed a bit too much. I fell asleep on the dance floor.
Oh my gosh.
And the next morning, I woke up too late for my exam. I cycled to university. I arrived late. The professor looked at me and says, seems like you had a good night last night. Maybe you should come this afternoon. We do an oral exam.
Ooh.
So she let me do the oral exam. I knew my stuff. Anyway, a year later, because it's very hard to get into the program in orthodontics in Germany. So I wrote an email after doing 1 year of VT as a dentist, and I wrote an email. Can you remember, I was a student not attending the last exam because you fell asleep on the dance floor in the club. And she wrote me a nice email back saying, I do remember you. You have your position in the orthodontic department. Welcome.
Oh my goodness. Everything happens for a reason, right?
So it's quite funny. So I have fun, but I know what I have to do in life. So that's how I slid into orthodontics and do all the things I do nowadays. Yeah.
Well, I'm glad you couldn't have your biscuits after surgery and you switched over to orthodontics.
I have now plenty of biscuits.
And now you can eat your biscuits in between patients. Well, thank you so much, Steffen.
Thank you.
From a Becker to a Decker, I very much appreciate this conversation, and let's have more of these. And of course, we're going to stay in touch, friend. Newfound friends. Absolutely. Thanks everyone for joining us, and we'll see you later.
I see you later. Take care. Thanks.